are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Open. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 30-year-old male patient presents to the hospital with a complaint of pain and limited mobility at the shoulder joint. Upon taking the history of this patient, the patient indicated that he is a professional swimmer, and of course he started experiencing these symptoms when he recently took part in a swimming competition. Now, based on the history and of course the physical assessment of the patient, coupled with findings of course some imaging studies by way of radiographs and of course MRI, the clinician came out with a final diagnosis of intertubercular sulcus syndrome. So this is the case study that we find before us, and of course we have some questions to go through it. And the first question is this: that what is this intertubercular sulcus? First of all, what is this intertubercular sulcus? Now, whenever we talk about intertubercular sulcus, one thing we are aware is that sulcus is found on, of course, the proximal aspect of the actual anterior aspect of what we call the humerus. And so what we see is that this intertubercular sulcus is otherwise referred to as bicipital groove. And so it is that sulcus, that is found between, of course, the superolateral greater tubercle of the humerus and of course the anterior inferior lesser tubercle of the humerus, at the proximal end of course the humerus. That's one thing that we see. So superolaterally we see the greater tubercle of the humerus, anterior inferiorly we see what we call the lesser tubercle of the humerus, and in between them there is this kind of shallow depression over there which are called the sulcus, and therefore we call it intertubercular sulcus. And because the same sulcus admits the tendon of the long head of the bicep brachii muscle, we also call it the bicipital groove. Now, second question for us is that what is the function or what is the role of this intertubercular sulcus? My friends, one thing we understand is that this intertubercular sulcus, as the name suggests, as we've also said, that is also called the bicipital groove. It is that groove which will allow, first of all, the tendon of the long head of the bicep brachii muscle tendon, the tendon of the long head of the bicep brachii muscle, which actually comes from what we call the supraglenoid tubercle of the scapula. So that is one thing. It will allow that tendon to run in there. That's number one. Number two, yes, it will also have to allow the tendon sheath, because I think there will be some kind of friction over there. And that is why this intertubercular sulcus will also allow for the passage of course, the tendon of the long head of the biceps brachii, muscle, actually the tendon sheath of that tendon will also run in there. And then finally, yes, I've said this already, that there will be an artery which we call anterior circumflex humeral artery. It will give off a branch which ascends upwards, goes and supplies, of course, the shoulder joint. And so we call that artery the ascending branch of the anterior circumflex humeral artery. That is also a content kept in there by what we call the intertubercular sulcus. So that is extremely important. Now, another aspect too that we can also look at is that when you look at this intertubercular sulcus, we have what we call the medial lip, we have the lateral lip, and of course we have the intermediate floor. The medial lip, there's a symbol that goes a lady between two majors. So there are three muscles which are tied there. Now the medial lip of the intertubercular sulcus will allow for the attachment, of what we call the teres major muscle. The teres major muscle, yes, is going to insert over there Okay, so I'll allow it to be attached over there. Then of course, in the what we call the floor of this intertubercular sulcus, we see the lady in there. And who is that lady? Latissimus dorsi. So latissimus dorsi, yes, we'll go and of course insert over there. And my friends, another muscle to attach there by way of its insertion point is of course the muscle that forms the bed of the breast. And that guy is of course the pectoralis major muscle. So it means that, I mean, by and large, apart from keeping the content, okay, by way of course, looking at the tendon of the long head of the bicep brachii muscle, together with its tendon sheath, and of course, the ascending branch of the anterior circumflex humeral artery, it will also provide attachment point by way of insertion points to, of course, I mean, by way of from medial to lateral, by way of the medial lip, we are talking about the teres major. I mean, the intermediate floor, we are talking about latissimus dorsi, and of course, I mean, talking about the lateral lip, we are talking about the tendon of what we call the pectoralis major muscle inserting over there. Now, the next question, where is of course the question number 3, is that yes, this question, the patient was diagnosed with intertubercular sulcus syndrome. So, my friends, what is this intertubercular sulcus syndrome? And so, one thing that I want you to know is that it is a condition that is characterized by inflammation and of course irritation of the tendon of the long head of the bicep brachii muscle as it runs through this bicipital groove or the intertubercular sulcus. Okay, that is one thing I want you to become aware of. Now, if you have seen what it is, then the next question is that what are the common causes of this intertubercular sulcus syndrome? Now, the first one, look at based on the clinical history of this patient. Yes, this patient said by way of activity, this person is a professional swimmer. It therefore tells you that he is always involved in something we call overhead activities. Okay, going beyond 90 degrees, abduction beyond 90, overhead activities, who of course, be one of the triggers for this, intertubercular sulcus syndrome. Yes, a direct trauma could also, yes, cause it. And my friends, even sometimes, one thing is that we expect that the content, as we mentioned, the tendon of the long head of the bicep brachii muscle together with the tendon sheath, as well as of course the ascending branch of the anterior circumflex humeral artery, they are kept in there with the help of a ligament, which we call the transverse humeral ligaments, spans from of course the greater tubercle to the lesser tubercle of the humerus. So what will happen is that if the ligaments, yes, compresses so much on the content over here, yes, of course, it will lead to this, this condition that we are calling, of course, intertubercular sulcus syndrome. Okay, that's also another thing. But my friends, due to anatomic variation, another thing too that can happen is that this intertubercular sulcus could be too shallow and also too little, okay, to keep all these contents in there. And so what will happen is that there could be that kind of compression again as far as these contents are concerned, leading to, of course, repeated, intertubercular sulcus syndromes. Okay, these are the things that I want you to become aware of. Now, if you have seen that, then my next question, which possibly is going to be the last question, is that what are the classic or the commonest, signs and symptoms that one will experience? Now, understand that in this case study, yes, the patient came with pain. So no doubt about that, there's going to be that kind of pain, okay, in this area. That's number one. Now, the other thing is that, yes, there will be limited mobility. That's what we said. You cannot really move the upper limb by the shoulder joint so much because, of course, you'll be experiencing that pain over there, limited mobility over there. And my friends, when you try to palpate it, okay, there will be that kind of tenderness as you try to, of course, palpate the area. Okay, one may experience pain once this area gets touched. Okay, these are the commonest things that, of course, you may experience with, of course, the intertubercular sulcus syndrome. Okay, so my friends, I believe you find this meeting helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.